you. Good morning.
Thank you so much for getting on the call. You guys listening, you can't imagine how elated I am to have Miss Peggy on the call. She is a phenomenal person. And believe it or not, Miss Peggy, can you just tell us really quickly, what was your profession prior to in your earlier years? What was your career?
I am a registered nurse. And
there you go.
Registered nurse. Yes.
And that's awesome.
I enjoyed working. My last job was working with children as a school nurse, but I've had psych, I've had OR experience, insurance, I've done everything.
Awesome. And that's important to hear. Miss Peggy was a nurse. So, Miss Peggy, tell us what your formal diagnosis was and when were you diagnosed? What year?
I was diagnosed in May of 2013 with multiple myeloma.
And what symptoms that you have that gave you the inclination that you needed to go to the doctors to seek out what was, your problems? What was going on?
Okay, my symptoms first started back in, and I will always remember this date, 12/12/12. And at that time, I had this very sharp pain in my right rib cage area. So I went to the emergency room, and they diagnosed me with anxiety, and they said because I was over 40, they said fat there in 40, and that it's your gallbladder, and it's anxiety, and you need to go see your primary care physician. So I went to see her, and she ran some tests, and she says, well, I'm going to send you to a rheumatologist who said I had giant cell arthritis. She did had the operation for that, too, and that came back negative. But they kept saying that, you have all these other, they sent me to a rheumatologist, a neurologist, a list of doctors. And finally, she said she got some blood work back that said that my M protein was spiked and that I needed to see an oncologist. So May of 2013, I went to see the oncologist, and he stated that I had multiple myeloma. They did the bone marrow biopsy. I thought I was going to die with that, but no, they did that. And once that was completed, he came up with the diagnosis of multiple myeloma.
Okay. And I can imagine that was like a shocker to your system. From your profession, I'm sure you understood the ramifications of the diagnosis. Even if you probably didn't know everything about it, you knew it probably didn't sound good. And what were the treatments that they offered you to deal with this new diagnosis? What did they do?
I knew the symptoms, my symptoms, but what I wanted to say, all the treatments that he had recommended, it didn't sound right, but I was pressured on both sides from my family, my husband, and from the doctor to do something now. And so within a week of being diagnosed, I was put on dexamethasone, Cytoxan, Valtrex, and it just totally wiped me out. Then they tried Velcade, and then Revlimid, and then Pomalyst. And then the latest has been the Darzalex, which is an immunotherapy. And, folks, I just want to tell you, each time I thought I was going to die. I couldn't walk. I couldn't talk. I couldn't see. My vision had blurred. My hearing had gone. I was just a wreck. I had neuropathy in my hands and my feet and my knees. I couldn't even walk. I was on the couch. I was a couch potato. And they told me that this is the way I would have to be the rest of my life. This treatment, I could never go off, and if they did, they'd give me a little holiday, but then I would have to come back on medication 21 days out of 28 of the month. And I figured this is no way to live. This cannot be normal. How can anyone even function, or who would want to live like this? And they wanted to put me on antidepressants, and and I was on, my bone pain was so bad, they put me on OxyContin, Oxycodone, and that just made it worse, and I couldn't continue to live like that.
Mm-hmm. So all of the names that you've named in terms of those prescription drugs, were those chemotherapy and antidepressants?
Yes, and radiation. I had radiation also.
Wow.
Which burnt my esophagus too, so I've had it both, the chemo and the radiation.
Mm-hmm. And what made you decide to seek out natural healing? I guess, number one, the frustration and the total feeling of being horrible all the time what drove it, but what really drove it? How did you find me?
Okay, when I was doing research, you get on, somebody said it was death by Google. I'm on the computer every night, late at night, looking up, researching, and I brought it down to the cellular level. I said, there's got to be a natural way to cure this. God has given us everything that we need, to be healthy. And so one day my friend Pat, she was going to go pick up some supplements from Dr. Reed, and she said, why don't you come and take a ride with me? I'm like, she says, you got to get out of the house and get some fresh air. So I went to Dr. Reed's office, and Pat had told her a little bit about me, and she said, you will love her, you will love her, you got to go talk to her. So I went to her office, and she took the time to talk with me, and I'm like, really? And everything that she was saying was what I had been reading about, and I'm like, well, this just can't be a coincidence. So right then and there, we did a hair analysis and a nano scan, and she gave me these supplements, and I started feeling better. So I said, that was the end of, that was 12 of 2013. And as a matter of fact, it was the 30th. And I said, well, this is better for me. I told my doctor I wasn't coming back. And that was it for me. I just knew I was on the right path now. God had opened the door and said, come this way, And Dr. Reed had always said, it's you take away what the body doesn't need, give it what it needs, and, hydrate, exercise, and you'll be fine. And, pray and I, meditate and all. And that's been my journey.
Mhm. Mhm. So, what made you decide to go back on your journey? So, and after 2013 and you started doing so well, something else happened that triggered a scare, and that scare took you back into the chemotherapy loop. Can you tell us about that?
Yes, I ended up with bone pain again, and it was like unreal. And then the doctor ran tests, and he said, oh, well, your M protein is spiked again, and so you have to come back. You're going to die without it. You're going to be paralyzed without it. And he said, you have these bone lesions. You have a lesion on your clavicle. And my clavicle felt like somebody had chewed it up or taken an ice pick or something and chopped into it. And my elbow, my left knee, and my left hip, he said, you have lesions there, and we need to take you to surgery and have them scraped down, filed down, or removed. And I was like, oh, no, I cannot go back that way either. But I ended up we compromised, and I ended up taking therapy, chemotherapy again, which I almost died from that too. It seems like I've done this 3 different times, and each time I've gone on the therapy, I've always gotten so ill that it's like, this can't be normal.
Mhm. And so you gave me a call, and you said, Dr. Reed, I'm in a state of panic again. What do we do?
Yes.
And that's when I said, this is what we're going to do. We're going to get on Z-Radical. We're going to get on the longevity protocol, and we're going to take away the stuff again that doesn't serve you and only give your body what it does. And what leap of faith did you do?
I started on longevity and the Z-Radical, and continued with the, being hydrated and, meditating and walking and just taking the supplements, and it made a world of difference. It really did. It cut back on the neuropathy. My vision came back. I had to go and get new glasses, and my vision came back. The ringing in my ears went away. My appetite increased. And I'm not crying. I mean, I was so depressed. I was crying. All that stopped. I got a new attitude.
One of the things that is so critical is you took your health into your own hands and you made some decisions. And what decision was that? Did you continue with the chemo, or what happened?
Okay, my last chemotherapy was this past summer. And at that time, it was a new treatment. It's immunotherapy, where they take your T cells and, they're supposed to, enhance your T cells, build up your immune system. But all of the medications that they were giving me, the Tylenol, the dexamethasone, and the other two medications. I can't think of them right now. That was the pre-op. It damages the immune system. And I couldn't figure out, well, if this is supposed to help the immune system, why is it tearing it down? And what happened, my immune system bottomed out. I had no white cells or anything, and I caught a really, really bad cold. They put me on prednisone again, and I told them I can't take prednisone. I broke out in 3 rashes all at once, 3 different rashes. And I later found out those rashes were medication reaction. I mean, my body was on fire. I thought I was going to burn up. My hands were inflamed. The rashes were burning. And I said, that's it. I can't do this anymore. And when I called the oncologist, he said, well, the next medication we have for you is Cariplis or something like that. And I looked up the symptoms for that, and that's worse than all the other medications that he had me on. And so I can't go back that way. I don't want to go back that way. That is death. I know I'm going to die if I go that way. My heart has been damaged since then, and I had a healthy heart, healthy kidneys, and everything when I first started. So I'm not going back down that road. So the leap of faith is the longevity and the V-Radical and other supplements and eating right. I changed the diet. It's more of a plant-based fish and chicken and turkey. Yeah, and lots of water. Just keep drinking water. And got rid of sugar and all the things that longevity, it says, the dirty, what is it called? The dirty dozen or more.
The 12 bad foods.
Yeah, that's it.
Yeah. So can I share the text that you sent me on December the 12th about the Frisbee with your son?
Yes, ma'am.
Okay. So on December 12th, Miss Peggy sent me this text, and it says, Merry Christmas and a healthy, safe New Year. We always send each other well wishes and cards. That's the kind of relationship we've built over the years. And it says, blessings to you. Hello, Dr. Reed. How are you? It's me again. I'm having issues. Help! In 3 exclamation points. But this is what you said. You said, all of my joints are making a snapping, crackling sound, plus my right lower rib area pain. On 10:30, I was throwing a Frisbee with my son, having the time of my life. I waited 4 years to do this. This is 1 month ago. 2 days later, I was getting out of bed. I felt a pop of my right lower rib cage area. Pain level was about a 7. Back in 12-12-12, that is where my troubles became, which led me to a diagnosis of multiple myeloma in 2013. Last chemo immunotherapy was in 2016. Really, I almost died. I quit. I did not panic, but really concerned. I waited a month until there was a burning sensation, same area but radiation to my back, 7 and 8 vertebrae area. Called primary care doctor. They gave me methotrexate 2 milligrams a day, which elevated my blood pressure. Pulse dropped to 44 with a regular heartbeat, short of breath. I stopped taking the dexamethasone. Back chest x-ray revealed no new bone lesions, no fractures or spinal involvement. I have complete mobility, lifting, pushing, pulling. Okay, but I'm guarding right now. I'm guarding my right side. The popping sound of all my joints and rib pain is unnerving. It sometimes takes my breath away, but no nausea, vomiting, BM normal and regular, appetite good, no fever, all blood work with no normal limits. I'm due for blood work this week. Yesterday I stopped all supplements, took Motrin, 400 milligrams, and calling it a day. Any idea what the popping sound and rib tenderness is from? I just want to be normal. I'm sending tons of supplements, change my mainly plant-based diet, yada, yada, yada. So I apologize for the yadas. But what I first said was to her, first of all, thank God that all your tests are completely normal and you have complete mobility. I said, reread what you just sent me.